This is Manu, Kalia, physical therapist and Ayurveda herbalist. So I'm going to show you a cross-friction massage technique for those of you who have Achilles tendon issues. So if there's an injury or there's partial tears, sometimes you end up forming scar tissue or adhesions that form along the injured area. And sometimes also tendonitis, which ends up turning into tendinopathies and other problems in that Achilles tendon. So if there's thickening or adhesions or tender points and things get painful and irritated, or it's just scarred down from minor tears or those things, you're going to work at breaking down the scar tissue and improve the circulation in that local area. Okay, so usually I do a technique, it's a 2-person technique, and I'll usually do it on a patient of mine. But I'm going to show you how you can do it yourself. And so there are a few different ways to do this, but I'm going to show you one way to self-mobilize that tendon yourself. All right. So first of all, Achilles tendon or tendonitis type issues. For that, we're going to look at here's your Achilles tendon. This is the area we're targeting right here. Right. So your gastroc calf turns into Achilles tendon, which goes and inserts or attaches right at your calcaneus, which is your heel bone. All right. So right at this point. So now, what are some of the sites or areas where you can have problems? So you can have issues essentially anywhere along that tendon, okay? And more commonly, you're going to find problems around this area, less in the upper part through here, or on the upper part of the tendon. More commonly right in here. Now, you can have problems on the medial side, which is the inside part of the tendon. You can have it on the lateral side. It doesn't have to be on the exact one spot. You can have it more posteriorly in the back of the tendon. You can also have it anteriorly sometimes in the front of the tendon. Okay, and that's where people end up missing it sometimes, and they can't get to it because they can't get to it and can't mobilize it or break down the scar tissue. And lastly, you can also have it at the insertion point right here where it attaches. And it's where a lot of times you'll find people who end up getting bone spurs or thickening right at that point because it's been constantly getting irritated through that area. When we think about doing scar tissue mobilization and breaking down those adhesions, we want to look at finding those tender spots. So let's say if this is the painful area, and sometimes it can be a little bit difficult locating the exact spot. You might find that you're on the right area, you're working on it, and you say, well, I don't feel that there anymore, but I feel it at another spot. So you might have more than one spot. You might have to work through the range of that tendon to get things moving again. So what I like to do is you want to, let's say I find this particular spot. So I'm going to grab on either side of the tendon, and I'm going to work in different directions. So I might go up and down first. So remember I have a little bit of pressure applied through here, and I'm going back and forth. Now, if I have more of the issues, let's say on the inside and outside, more posteriorly, more in the back, I might even do a little bit of dorsiflexion, which is bringing my foot up. So you can see how that tightens up that tendon there, just a little bit. And now I can work, this is more exposed from the back, so I can get to that tender spot. I put a little pressure on that, and I move back and forth, up and down, and I can go side to side also. Put a little pressure, I can move side to side. So it's not pleasant, obviously. It's tender, especially if you're working on a thick spot. So it's not comfortable. But over time, it gets easier. As the area gets softened up, you break down the adhesions, and it's much easier to move. So I look for it, and I work on it, work on it, work on it. You know, spend about 5 to 10 minutes if you can. 10 is the max. And you can do that 2 to 3 times a week. You want to work on it almost every other day. Now, you might find that, okay, well, I can get to this spot, but how do I get to that anterior part right here, which is usually hidden? For that, you want to do is you want to relax the foot more. So I do some plantar flexion, bringing that foot down. Now, you can see it puts a little more slack. So it allows me to get behind that. So I'm trying to get basically behind that, or in the front of that tendon. So let's say if it were more on the medial side, I could use my finger, and I can stabilize with the other finger, and I can get in here, and I can do stuff this way too. I'm on the front side of that tendon. I'm working on doing cross-friction work. Or I can grab with my thumb in that, and I can get in at the front, and I go up and down, and then I can go back and forth also to break down the adhesions. And if it's down through here, same principle, I can use my thumb, and I can go across, and I can look for tender spots, and I can work through there, or I can go up and down. So you're basically applying pressure and you're moving back and forth, okay? Firm pressure. This doesn't do any good if I just do this. It doesn't really help it at all, okay? I'm just moving the skin. So, as I said, find those tender spots and get in there and work on those. And it's going to be a bit tender, but over time it gets easier and easier. And make sure you compare your left versus right side and see if you're having issues, whether both sides are as tender. You know, it might not be that you have ongoing issues necessarily, but it might be just that the tissues are just really tight and they're just not moving, okay? If you have any questions, make sure you leave a comment and click on the link below, check out my site, and subscribe to the channel. Thanks.